Parkland, like many hospitals, is a busy, complex place where talented, knowledgeable, and experienced individuals save lives every day. We know that people experience unintentional harm due to medical errors. One of our number one goals of care is do no harm. Here at Parkland, we are committed to doing everything we can to prevent medical errors, big and small. What you're about to view are the many ways Parkland follows the Joint Commission's 2017 Patient Safety Goals. These goals not only help shape the way we care for our patients, but also provide us with best practices to keep our patients safe. Here at Parkland, patient safety is not just the focus of physicians and nurses. It is the responsibility of everyone in our entire healthcare system. Our goal is to provide safe patient care from the time you enter our door until you return home. We are Parkland Proud.
My chest. My chest.
Hi, you look like you're not feeling well.
I'm having some chest pain.
Let me get someone to help. Trevanya, can you bring us a wheelchair, please? Let us get you to the wheelchair.
Careful. Thank you.
Okay, we'll take you to the pod.
Yeah.
Good morning, my name's Trevanya. I'm going to be your nurse today.
Hello.
Hi. For your safety, I'm going to ask you your first and last name and your date of birth.
Yes, it's Wanda Smith, 4/20/58.
Okay. All right, Ms. Smith. Going to complete your assessment, I'm going to ask a couple of questions. Now, these questions are personal, but we ask everyone that comes and enters as a patient these questions, so it's important that you answer.
Okay. Go ahead.
Okay. In the past month, have you witnessed suicide of a patient while in a staffed around-the-clock care setting is a frequently reported type of centennial event. Identification of individuals at risk for suicide while under the care of or following discharge from a healthcare organization is an important step in protecting those at-risk individuals.
Good morning, Mrs. Smith. I'm Claudia. I'm a nurse practitioner. I'll be working with the emergency room doctor today. Oh, but before we get started, let me verify your name and date of birth for your safety.
Wanda Smith, 4/20/1958.
Great.
Okay. I'm having some terrible chest pain and I'm very weak.
Well, due to your complaints and your abnormal vital signs, we're going to have to admit you for further workup. We will keep you updated on everything. You have my word.
Wait, do you know how long I'm going to be here?
I'm not sure how long it'll be, but we will be here every step of the way helping you get better and back to normal.
Thank you. Just anything to get better.
Okay.
According to the Centers for Disease Control and Prevention, each year, millions of people acquire an infection while receiving care, treatment, and services in a healthcare organization. Consequently, healthcare-associated infections are a patient safety issue affecting all types of healthcare organizations. One of the most important ways to address HAIs is by implementing the hand hygiene of healthcare staff.
Hello, my name is Joaquin and I'm with Phlebotomy Services, and the reason why I'm here is because your doctor ordered lab work for you today.
Okay.
Now for your safety, can you verify your full name and date of birth, please?
Yes, it is Wanda Smith, 4/20/1958.
Perfect. Thank you.
What labs did the doctor order?
Your doctor ordered lab work to check your blood levels to see what's high, low, or normal.
Well, how am I going to know if anything's wrong?
If anything were abnormal, your doctor and nurse will notify you.
Okay, thank you for explaining.
You're welcome, Ms. Smith.
Wrong patient errors occur in virtually all stages of diagnosis and treatment. The intent for this goal is twofold. First, to reliably identify the individual as the person for whom the service or treatment is intended. Second, to match the service or treatment to that individual. Acceptable identifiers may be the individual's name or an assigned identification number. The patient's room number or physical location is not used as an identifier. 2 patient identifiers, every patient, every time.
Hello, my name is Patient Transport, and I'll be taking you to your room. No need to get up. You can stay on the stretcher. But before I do, can I have your name and date of birth?
Sure. It's Wanda Smith, 4/20/1958.
Thank you, ma'am. I'll be taking you to room 12437.
Does it at least have a window?
Yes, ma'am. It has a window. Yes, ma'am.
Our bioengineering department works behind the scenes to check and calibrate various medical equipment. They are responsible for ensuring proper function before the equipment reaches our patients. The engineering department is responsible for basic and routine repair, preventative maintenance tasks, and maintenance documentation throughout Parkland to ensure our facility is safe and operational. We thoroughly clean our rooms using approved guidelines to prevent the spread of infection. Patients continue to acquire healthcare-associated infections at an alarming rate. Risk and patient populations, however, differ between hospitals. Therefore, prevention and control strategies must be tailored to the specific needs of each hospital based on its own risk assessment. The elements of performance for this requirement are designed to help reduce or prevent healthcare-associated infections from multi-drug-resistant organisms.
Good morning, Mrs. Smith. My name is Estella, and I'm going to be your nurse for today.
Oh, it's nice to meet you.
Nice to meet you as well. Can you please verify your name and date of birth?
It's Wanda Smith, 4/20/1958.
Thank you. I'm just going to review your home medications with you.
They've asked me this in the ER.
I understand it, and I know it's frustrating, but just for your safety purposes, we need to make sure that we are giving you the correct medication and dose.
All right, it's over there on the counter.
Thank you. I just have to go over a couple of questions, and we'll be done with your assessment and admission.
All right, go ahead.
There's evidence that medication discrepancies can affect patient outcomes. Medication reconciliation is intended to identify and resolve discrepancies. It is a process of comparing the medications a patient is taking and should be taking with newly ordered medications. The comparison addresses duplications, omissions, and interactions, and the need to continue current medications.
Hi, this is Robin from the Rapid Response Lab. I have a critical lab result on Wanda Smith in room 347.
That's correct. I'm the nurse for her.
Thank you. Okay, her medical record number is A3845, and her potassium is 2.8, and it was collected this morning at 7 o'clock.
Critical lab value for Miss Wanda Smith, medical record number 83845, and date of birth 4/20/1958, potassium level of 2.8. Hello, this is Estella calling from the 12th floor, 300 block. Are you on Mrs. Smith's case?
Yes, I am.
I just want to inform you that Mrs. Smith had a critical lab value today. Her potassium this morning is 2.8. She's asymptomatic at this time and no events on telemetry so far.
Okay, is this for patient Wanda Smith, date of birth 4/20/1958, MRN A3845?
Yes, that's correct.
Okay, I'll place orders in Epic now. Thanks for informing me.
Critical results of tests and diagnostic procedures that fall significantly outside the normal range may indicate a life-threatening situation. The objective is to provide the responsible licensed caregiver these results within an established time frame so that the patient can be properly treated.
Good morning.
Good morning.
Can I have your name and date of birth?
It is Wanda Smith, 4/20/1958.
All right. So we've reviewed your labs and the team has discussed your progress and we think that you're ready to go home. How do you feel?
Oh, I'm feeling so much better. Everybody's been great. I'm so glad that I came to the hospital and decided not to wait.
Well, great. And I know your family misses you and we want to get you home.
Yes, thank you.
Hi, Miss Smith. My name is Lacey. I'm going to go over your discharge instructions, but before I do, can I please get your name and date of birth?
Sure. Wanda Smith, 4/20/1958.
Okay, great. Over the course of your stay, we've gone over all your medications and the ways to manage your disease while you're at home. Do you have any questions for me?
Oh, no, you guys have been so great. I'm just ready to go home. I know how to take care of myself better now, and I'm ready. And you guys, I don't know how you keep this hospital running. There are so many moving parts, and you keep us safe. Thank you. My care was great.
That's just a representation of the many steps we take all the time to prevent harm and keep our patients safe. As you can see, our delivery of care here at Parkland involves an environment that values all members of the care team. To that end, we've also leveraged the integration of advanced healthcare technology, enhancing our ability to keep patients safe from medical errors. It only takes one breakdown in a task or communication to set off a catastrophic chain of events that can lead to preventable harm. We proactively seek to identify those areas of potential risk and work with our team members to develop a plan of action. In the same way, we educate our patients and families to keep them informed on how to speak up for their safety. Our intent with this video is to show how our team, which includes our patients and family, is the glue to having a safe environment. After all, we are all patients and we work to keep each other safe here at Parkland, always.